So, what, so maybe one thing to say first is, that the number one cause of kidney disease is type 2 diabetes, right?
Mm.
Out of the 40 plus million people in the US with kidney disease, half of them at least have it because of they have type 2 diabetes. Kidney disease is, actually the number one complication of type 2 diabetes that impacts people's lives. That you lose your vision, and those are definitely bad things, and they happen. But much more common is chronic kidney disease. So people with diabetes can actually lose their kidney function. They end up on dialysis, and of course, what happens in diabetes is, essentially carbohydrate overconsumption leading to persistent hyperglycemia. So you have persistently high blood glucose levels and all these blood glucose spikes, and that's causing insulin spikes. And those are actually the things that impact the kidneys. So the glucose itself can impact the kidneys and essentially damage blood vessels in the kidneys, leads to glomerular dysfunction. The insulin causes hypertension, and hypertension is actually another cause of kidney damage.
Mm.
So to me, it would seem pretty clear, if you want to diminish the impact of chronic kidney disease, you don't want to recommend to people to eat a high carbohydrate diet all day long, right? Because it can only possibly worsen it. And that's, however, not the thinking in the field. So people are usually not advised to go on a low carb diet. So that
Mm.
hasn't happened yet.
Wow. So it seems like kidney biology and nephrology has a long history of getting things pretty much backwards.
Yes, I think that's very, very true, unfortunately. So the way we stumbled on it in my lab is so we have been studying a genetic form of kidney disease, of chronic kidney disease, and that's called polycystic kidney disease. So out of all the cases of chronic kidney disease, about a couple of percent of them are actually genetically have a genetic underpinning, if you will. And the most common form of that is polycystic kidney disease, or PKD. I'm just going to say PKD for short. So, there can be a mutation in one of two different genes, and that leads to polycystic kidney disease. And the dogma in the field of polycystic kidney disease has always been that it's really the gene mutations that drive the disease progression, and essentially patients are told, "Oh, you got the gene mutations. You're screwed. Sorry, there's nothing you can do. There's no diet or lifestyle that could possibly change anything." And that's why nutrition and lifestyle changes had not been part of the management of PKD.